Hello all, I'm Mrs. Vinnie Matthew, nursing tutor working with Oyster Nurses Academy, Kerala. We provide guidance for the prometric examination classes for different Gulf countries: Saudi, Oman, Qatar, Bahrain and UAE. Today we'll see about Huntington's disease. Huntington's disease is a rare inherited disease that causes the progressive breakdown of nerve cells in the brain. Huntington's disease has a broad impact on a person's functional abilities and usually results in movement, thinking, and psychiatric disorders. Moving on to the symptoms, Huntington's disease usually causes movement, cognitive, and psychiatric disorders with a wide spectrum of signs and symptoms. The movement disorders associated with Huntington's disease includes involuntary jerking or breathing movements, muscle problems such as rigidity or muscle contractures, slow or abnormal eye movements, impaired gait, posture and balance, difficulty with speech or swallowing. Cognitive impairments associated with Huntington's disease include difficulty organizing, prioritizing or focusing on tasks, lack of flexibility or the tendency to get stuck on a thought, behavior or action, lack of impulse control that can result in outburst, acting without thinking, lack of awareness of one's own behaviors and abilities, slowness in processing thoughts or finding words, difficulty in learning new information. The most common psychiatric disorders associated with Huntington's disease is depression. Signs and symptoms includes feeling of irritability, sadness or apathy, social withdrawal, insomnia, fatigue and loss of energy, frequent thoughts of death, dying or suicide. On to the causes. Huntington's disease is caused by an inherited defect in a single gene. Huntington's disease is an autosomal dominant disorder. Each child in the family has a 50% chance of inheriting the gene that causes the genetic disorder. Diagnosis: a general physical examination, a review of family medical history, neurological and psychiatric examination. For assessing the structure or function of the brain, MRI or CT scan of the brain, genetic counseling and testing, predictive genetic test. Treatment: medications can lessen some symptoms of movement and psychiatric disorders, and multiple interventions can help a person adapt to change in his or her abilities for a certain amount of time. Medications includes drugs to control movement, antipsychotic drugs, antidepressants, mood stabilizing drugs. Therapies used are psychotherapy, speech therapy, physical therapy and occupational therapy. Thank you. See you all soon with a new video.